Hey, new little video. On this one though, it's a little bit of a special video. I'm going to do a review of a gear that I don't own or never really touch it. But it's basically just on the content of it. But I don't quite really need to have the kit to just, it's not so much about the quality of it as the content of the kit himself. Yeah, I was watching a video, and on the side there I saw that link, and so when I click on it, it brought me to this kit. And I mean, I did. If you've been following me on my channel, I did a review on the book that they did because everybody was talking about it, so I bought it. I was very disappointed. There was a few exchange actually on the site about it. Didn't change my mind about it because it's still and actually, but anyway, second book came out. I didn't really bought it, so because I didn't see the point, but it seems like it's a little bit better. I don't know, but anyway, I checked that kit, and yeah, here's my review. Overall, it's very good. It's a very decent. I should say not very good because there's a lot of things I don't like about it, but it's a very decent kit. But I find that for the price range and the equipment that you get, there's too much. It's too heavy, like 24 pounds. So right now I'm watching on the website there. It's 24 pounds. It's $700, and for the equipment you get, there's a lot of stuff that basically could be removed from the kit, and the kit would be maybe even a little bit better. And there's things I find that are missing. First of all, the things I like, very heavy on medication. I kind of really like that little pocket with all the Tylenols and the aspirins and stuff. I really like that. Actually, even that little kit for essential oil seemed very decent. I'm not an expert in that field yet. Actually, I just found a course that I'll probably take in the next year or so on getting more specialized in that field. But I really liked it. I like those meds. There's a lot of them that I heard the names and know about them. Now to debate are they good or they not good, then that depends on which schools of the Western medicine. They're really against those things. If you're more into so I'm kind of in between. So far I'm still reading things about it, and I mean the World Health Organizations themselves recognize that about a lot of the countries, 80% of the medication they use are from plants and herbs. So if the World Health Organization kind of give the support to that, I think there's something to it. So there's so for that part, I really like that. One thing, so this is the big thing I like. Like I said, the quality of the bag looks very awesome, there's a lot of stuff in it, and I have to tell you the truth is, like, I've been really trying to like their product and video because they seem so sweet, and I know people that know them, and they say how sweet they are and everything, and they really put their heart and passion to it. So I really liked it, but there's a lot of things I kind of disagree with their care and stuff. So yeah, let's get back. Let's get into it. The first thing that I see here, the oral airways. I don't see why a kit should have oral airways versus nasal airways. And in my kits, you don't see oral airways for that purpose. Because the problem with oral airways is that you have to be very unconscious to put somebody in that. So that's the first big disadvantage of it. The second one is that if you need to carry a whole bunch, so a whole set from pediatric, it's about that big if you have to, because they're really hard plastics, and you have to measure and you have to have different ones. Like I was saying, if you have one or two nasal ones, so I would recommend maybe two. because the advantage is that if the person is really unconscious or you really need to oxygenate them, you can put two in the nose. And if you have more than one person, then. But if you have two, then they can serve a whole line because you just chop it the way you need to go, and you can carry way more in different kits. So you can make mini kits with other kits, all having airways inside. So yeah, that's one of the first thing that like you see, there's 8 oral airways, so it takes quite a space to have those ones, and it goes from pediatric to large adults with those ones. The second thing is there's a lot of redundant medication I find for a kit that is, and actually that's one point I wanted to bring as well. The If you go on first aid kit, and it's not really it's more common than a thing, is that when you go on first aid kits, let's say Adventure Medical Kit, because they're well renowned and they're sold a little bit everywhere and stuff. When you buy their kits, because it's for everybody, nobody that really, it's not really for specialized people. A little bit what they sell to people that don't have that much knowledge, or they're not a healthcare professional and they want to buy a kit, put it in their bug out to their car or something, and kind of not think about it. Is that they sell their kits and they say this kit is for 1 to 2 days, 2 or 4 people and stuff. This kit I find is very vague. It doesn't really tell you. It says, yeah, we're above the other kits, but how much? Is it like for a week kit? Is it even like if you go and buy, let's say, a Red Cross kit, they'll say a 3-day kit. Is it for a week, 2 weeks, a month? What is it? Because it's hard then to assess the kit that you need depending on what you have. Like, I mean, if we're going, let's say, as I'm preparing my kit, which is the 2-month period, so the kit that I carry at home to the portable clinic is a 2-month period. Well, that kit is quite not sufficient on wound care and a lot of other stuff. Medication most likely would hold, but not on wound care. So right there, if you don't calculate for that, then it's not. If it's for 1 week, yeah, sure, it would probably hold and even have a little bit more. So actually, there's even probably other stuff that you would kit, and then you would probably cut on the kit. So that, you see, as I say, is that because it's not specialized really what kind of purpose of the kit. It's for like it's called like the family medical survival bag. But again, how big a family? Is it for pediatrics and adults? Is it to a family? It's not quite specific. So yeah, so it's it would be nice to have that extra, so that you can, now when you say, okay, I need this, okay, well, okay, I'll probably have to add stuff and everything, or this is what it should be for. So so I find like there's a little bit of a you know, well, they don't want kind of specialize. Well, we're a little bit more than a trauma kit, but then if you put in, well, we're a little bit less. So it's a little bit vague about what it is, and it makes it hard to adjust about like, okay, is it for a week or 3 days? If it's for 3 days, this is way too much stuff. It's for a week. There's things that are kind of way too much again. And for 1 month or 2 months, there's not enough stuff on other parts. So see what I mean in that stuff. So back to what I was saying. So the burn gel. I think that burn gel, with all the other stuff that they have, not quite necessary over here. And we'll talk a little bit more about wound care. I think wound care over there, and it's a philosophy, I guess. But there's a lot of stuff there. There's not enough things on wound care that I would like to see. And again, it's this whole philosophy of sticking to gauze, and there's not enough. And I'll show you even with a quick example when I get to this. But the burn gel, I think I would skip that. Not really necessary, especially with the lidocaine. The purpose of the lidocaine is that it's to decrease the pain. But as you kind of saw when if you follow my channel, when I did my burn, and it was a severe burn, the pain was because the nerve were feeling. So that's what lidocaine decreased. But again, if you put too much of that, so if you have a lot of, let's say I have a big surface, let's say I burn my arm, and somebody that don't quite know how to use that stuff, depending of how much lidocaine, it's probably 2% or 4%, depending. I'm not quite sure about. I'm not familiar with the United States because sometimes they have way more. Well, 4% lidocaine over a certain period of surface, depending of your weight, there's a percentage you can become what we call lidocaine toxicity, and because basically it becomes absorbed in your body, and it's pretty severe, and it can affect your heart and things like that. So anything that has lidocaine, I'm a little bit reluctant to use because of that. Because a lot of times, especially in the hands of people that are not quite familiar with medication like that. Just for example, when we had people with road rash, we used to put lidocaine gel on them, and it was a 4% function, and then we would put that. But again, that was healthcare professional, trained nurses and stuff, and they used to put a little bit too much, and we got a little bit concerned that we were giving them lidocaine toxicity. So right there, that's another one. So there's a bunch of stuff. The triple ending ointment, sure, we can have it. So now we get into the part that I not. So if you listen to and she referred to it many times, and I did listen to it. The wound care. So how to properly use gauze. So in their philosophy, when you have a wound, you need to use sterile gauze and sterile gauze only.